of fever, and his blood oxygen level had dropped rapidly. But he's made unbelievable improvements from yesterday morning when I know a number of us, the doctor and I, were very concerned.
White House Chief of Staff Mark Meadows yesterday detailing serious concerns about the president's health. His remarks contradicted the rosier assessment White House physicians gave, raising questions about transparency and whether the administration can be trusted when it comes to the president's health status. With us now is Brad Blakeman, former deputy assistant to President George W. Bush. He was also an advisor to the Bush-Cheney campaign. Brad, it's always great to see you.
Great to see you.
I mean, Kristen Fisher was saying at the top of this broadcast, we still have not had the White House come out and kind of clear the deck and set the record straight, kind of giving us a point by point. Why not, Brad? Why, in your assessment, would the White House not come out and say, okay, here's where we stand?
Because the doctors did it. I think the doctors have done a great job, and everybody should stay in their lane. If you're not a doctor and you're a staffer and you're not competent to talk about the medical condition of the president, then you leave it to the professionals. I really don't see much of a difference as to what the chief of staff said to what the doctor said. Maybe he was alarmed because, as a layman, anytime you see somebody who's so robust getting oxygen, they may be more concerned than the clinical people who are treating the president. After all, you just talked about the NFL. When we see a robust quarterback go on the sidelines and take oxygen, nobody is concerned about whether he's going to be able to finish the game. The fact is they have been transparent, I think satisfactorily, but it always helps when people stay in their lane and their core competency and leave it to the medical professionals to give us the kind of information that we're entitled to in assessing the president's health.
You say stay in their lane and leave it to the medical professionals, but even Dr. Sean Connolly came out this morning, Brad, and said, well, listen, I didn't give you all the information yesterday because I was trying to keep the president's upbeat theme going here. What did you think about that response from Dr. Connolly?
Well, I think that he corrected the record, but what the doctor omitted or didn't tell us was not material to the president's condition. It was incidental. Receiving oxygen when the president has such high blood oxygen levels is not extraordinary. And I'm not a doctor. How do I know that? Because that's what the doctors have told us.
Yeah, I don't know if we had this to put on the screen, but I want to read this from the Wall Street Journal, the op-ed. Partly it reads, in quote, Americans want to know the truth about the president's health, which bears on current governance and election in a month. The White House needs to reassure Americans, not with happy talk, but with daily medical briefings that are candid and complete. What do you think?
I think the editorial was unnecessary. I think that's exactly what the White House is doing. Look, I know what I saw the other day when the president got on the helicopter. There was no difference in his gait, his demeanor. He gets on, he gets off. They did a photo release of him working in the hospital. This all jives. I'm waiting for the conspiratory people to say maybe there's a body double that wasn't the president who got in the helicopter. I mean, in an election cycle, they're so close to the election. There's always these people who are armchair doctors, and they're unreliable. So let's listen to the professionals. Let's listen to the doctors. The president has the best doctors in the world caring for him, both at the White House and at Walter Reed.
And I think you're exactly right on the whole mixed messages thing being a little bit overblown because, the chief of staff, Mark Meadows, he was talking about the president's health, and he came out and said some things that people were astounded about. And then it turns out the doctor said, well, he was right. He was pretty much right. And we didn't really, want to build that up because we're trying to keep things optimistic. And the question is Mark Meadows, though, still in the doghouse for coming out and saying those things? We know the president wasn't all that pleased with the way things transpired yesterday.
Look, it's a lesson for everyone. Let the doctors tell us what the president's course of treatment is, what his long-term assessment is. Look, the best news that we can have from the doctors today is the president's likely to return to the White House tomorrow. That certainly wouldn't be the case if he was needed to remain in the hospital. The president has the ability to have a medical unit to continue his course at the White House. I see no change in the fact that the president is working as we speak at Walter Reed, which the doctors are encouraging.
Yeah, I wonder, Brad, if that's why the president kind of released that video, that 4-minute video statement last night. Was the president saying, you know what, I'm going to handle this. I'm going to just, let's not have the White House come out. I'm going to handle this. I'm going to tell you exactly how I'm feeling. What do you think?
look, there's nothing better than hearing it directly from the patient in his own words. And the fact is, if he was unable to communicate, he wouldn't have done it. So this all jives with the medical assessments and the reports that we're getting from his doctors.
Brad Blakeman, it's always good to see you, sir. Thank you for coming on.
Thanks, Trace.
Well, the governor of